Hi everyone, this is Shalini Bhargava and we're going to be talking about the weight gain during pregnancy and how to lose it postpartum. Pregnancy is a very important period in your life, and you all know that it takes 9 months for the baby to come out. So you're pregnant for 9 months, which also could mean that you have been relatively inactive. I'm saying relatively because if you may be exercising during your pregnancy, which is a superb thing in itself, or you may not be exercising due to some reason or the other. So it's not normal, and you have been in that position for 9 months. So be patient with yourself, be kind to your body, be kind to yourself, and don't be in this mad rush to get rid of the pregnancy weight postpartum. Take it easy, listen to your body all the time. There are added responsibilities. You have a child to look after, you have your own self to look after, you may have another child who is older than the newborn baby. So there are a lot of things which play a very important role. So my advice is just go easy. If you have taken 9 months to gain that weight, give your body 9 months to lose that weight. The most important thing post-pregnancy is to tighten up your core muscles, because these muscles have got weakened during your pregnancy, especially your pelvic floor muscles, your abdominal muscles, your back muscles, unless you have been doing core strengthening exercises during your pregnancy. So let's talk about the core first, which is very important. So the core is your entire band, this corset that runs around your midsection, which includes your abdominal muscles, your back muscles, your hips and inner thighs, and your pelvic floor muscles. So during pregnancy, these muscles have turned lax, and it is very important to build up the strength and endurance of these muscles. Besides that, when you're talking about weight loss, it is always the number of calories expended and the number of calories you are consuming. When you create a negative deficit in whatever way you can, you will lose weight. Now, post-pregnancy, the number of things that you have to keep in mind is that you cannot starve yourself. Your body needs the right nutrition, your baby needs the right nutrition, because I'm assuming you're breastfeeding your baby. So make sure that you don't starve yourself. You don't go on to those low calorie 1000 calories and 1200 calories a day diets. Stay hydrated, that is very important, and go easy on your exercise. You just start slow, go for a walk, go for swimming, just start slow, start yoga, start Pilates, but whatever you do, just start slow. Give your body time to accustom itself for this new experience that the body is going to now get. It's like being born again and starting all over again. Having said that, if you have been exercising during pregnancy, things are much easier because the muscles are still not as lax as they would be if you were not exercising and were not active during pregnancy. So having said that, I'm a big advocate of be active during your pregnancy, keep exercising during your pregnancy, unless you have issues that your doctor has told you not to exercise. Okay, so now depending on what kind of delivery you've had, whether you had a normal delivery or a cesarean section. So cesarean section, of course, there are stitches and there are layers of stitches which you need to take care of, and so you will go even slower. So the basic guideline to lose weight is to expend the calorie, cut down on all the fatty things that our Indian system, our Indian mothers and mother-in-laws feed us postpartum. Yes, we don't need them. We just need the right kind of nutrition, the right kind and right amount of protein, carbohydrates, vitamins and minerals. Make sure you have that balanced diet so your body is nourished from inside out and you don't feel weak and fatigued all the time. Hydration is very important. And then we come to exercises. So you could start with a walk. Once you actually begin to start, you could start with light Pilates or light yoga exercises, and then gradually move on to more intense exercises. But in no ways are you going to jump into boot camps or high intensity interval training, because please realize your muscles are weak and lax. Your body is not what it was 9 months earlier. So you have to gradually build up that stamina and that strength so as not to injure yourself. Also, please make sure that you ask your doctor about something known as diastasis recti, in which the ab muscles have opened out, because there are certain exercises which are contraindicated for the first few months. So build up on your muscles. When you build up on your muscles, your metabolic rate is going to go up. You will start expending more calories and the weight loss will happen on its own. But be kind to yourself. So here are a few exercises that will build up your core muscles. Of course, the cardio part is your walking, swimming, cycling. There are excellent cardio exercises. You could, after your body gets accustomed to these exercises, you could go on to vinyasa yoga, and that will expend calories as well. As far as the core conditioning is concerned, here are a few exercises which are core strengthening Pilates based exercises which you could do to strengthen your core muscles. The easiest one is the plank, but to execute the plank, please make sure that you are in a good technique. So just stay here, hands are under your shoulders, knees are under your hips, hands are shoulder distance apart, knees are hip distance apart. Engage all your core muscles, so like really scoop your abdominals in, tighten your butt, engage your thighs, and this would be your prep to the plank. Once you've got this, then you could extend one leg out and just hold it. Once you can hold this, you can extend both legs out and hold. Now in a plank, most of your muscles are getting worked. From the shoulder to the back, legs, thighs, hips, and of course abs. So practice holding the plank for a minute. The next exercise you could do is plank on the elbows. So here is your low plank. Elbows are in line with your shoulders and are shoulder distance apart, and the body is in one line parallel to the floor. Hold each muscle engaged and tight, and here you are. See if you can gradually progress to holding the plank for a minute. And the plank, there is no movement, it's an isometric contraction, it will work most of your core muscles. You could then progress to a side plank, either on your elbow or on your hand. Again, make sure that your shoulder and your elbow are in line with each other. Your body is absolutely streamlined. The prep would be one leg down like this or one leg down like this. Once you are comfortable with this, push both legs up. So my body is in one straight line. And then make sure you switch to the other side. The plank on the hand would be, place your hand about just 5 degrees ahead of the shoulder. So this, you make sure that you don't injure your shoulder. And then again, you could be on one leg, or you could be on one leg, or you could be on both legs. And hold it. So each plank you could progress, starting from 20 seconds to 30 seconds, progress it to a minute. Once you've done that, there is an exercise called Bhargava, where the prep would be to be in this tabletop position. Shoulders are over your hands and your knees are under your hips. Extend opposite arm and leg together. So I'm extending my right arm and my left leg and reaching out with my right arm and my left foot in this tabletop position. Hold it for 10 seconds and then probably lift for 10 counts. While you're doing that, you make sure that your body is in a tabletop position parallel to the floor and not scooping up and down with the movement of your arms and your legs. And then you're going to switch. So then the left arm is going to come up and the right leg is going to come up. Next you could do is hip raises. So lie down on the mat. Your feet are hip distance apart and closer to your hips. You could keep a small ball in between your knees so as to engage your inner thighs. The idea is that basically when we lift our hips up, we don't want the knees wobbling in and out. So lift the hips up, squeeze the hip tight as you lift and down. Exhale to lift, inhale to lower down. Exhale to lift, inhale to lower down. You could do a couple of these, about 20, and then progress. Once you're done with this and you're comfortable, you could do this with single leg. So I'm going to keep one leg to tabletop where I'm bent 90 degrees at the knee and the hip, and then I lift the leg up. 2, keep lifting that hip up. 3, 4, and then remember to switch sides. So this is going to take care of our the hips, Another exercise which you could do in this position is the diamond, which is going to work our inner thighs. Join your feet together, the knees are opened out to the side, extend the legs up, bring them back down towards your pelvis. Extend the legs up, bring them back down. So as you're extending the leg up, you're pulling the kneecaps, lengthening the legs all the way and bringing them down. One word of caution while you will be doing this is to keep the back into the mat and hold your abdominals tight in so that the back does not, I'm just showing you, does not arch out like this. So if your abdominals and your back muscles do not have enough strength to support the weight of your legs and you're not being able to extend full, no worries. Extend as much as you can, open the knees out to the side, and then gradually you will be able to extend all the way up and bring them back to the side. The next exercise which you can do for your hips is to lie down in the sideline position where your body is absolutely in one straight line. Bend the bottom leg, flex the top leg. So my heel is pressed out. One hand is down on the floor for me to balance and then lift this leg up and down. Start with 10, progress to 15 and 20. Once you finish this, then you can add circles to this. Now, when you circle, imagine you are between two glass panes and the body cannot move forward or back. So, the stability of the body is very important. Make your circle as big or as small as you can be stable on that body. So, you can again do 10 forward and 10 back and then progress to 15 and 20. And then you will switch side and do the same thing. For your back muscles, you're going to lie down on your stomach. Keep your feet hip distance apart. Toes are pointed outwards. Your hands are next to your chest and your elbows are down on the floor. Now inhale and push your chest up towards the ceiling. And exhale to come down. Make sure your shoulders are dragged down away from your ears as you inhale to lift up. Exhale to come out. Keep the neck lengthened. Inhale to lift up, exhale to come down. You will again do 10 and then progress. The second part would be to keep your hands by the sides of your hips, palms facing towards your thighs, and then create this one long line as you lift the chest up and down. So basically you're darting your head forward and down. And then the third modification would be to keep your hands under your forehead, shoulder blades dragged down, keep your hips and your abs engaged and lift. Inhale, lift. Inhale, lift. So you're going to do 10 of those and keep progressing. These are 3 progressions that I've shown you, and these will help in working up your back muscles. And then lastly, for your abs, you can lie down on the floor and then simple crunches, as many as you can do. Remember that you are pushing the ribcage towards the pelvis. Exhaling as you come up, inhaling as you go down. The next exercise could be single leg stretches. So hold the belly in, lift one leg. If you have enough strength to come up and then kick one leg out at a time, do that. Or for starters, you could start with this. Then you could add both legs together, exhale. As you're lengthening the legs out, pull the belly in. So these could be 2 exercises to start with. The third could be your toe taps. So again, your legs are lifted up in the air. If you have enough strength, you could pull yourself up and then just tap and tap and tap and tap. Remember to exhale as you do that. Turn around on your side and get up always. So guys, these are some of the simple exercises that you could start your fitness journey with postpartum. Cardio is important. Start with walks. Go easy on yourself. Progress slowly so as to avoid any injuries, and please do not stress. Thank you so much. This is Shalini Bhargava.